Welcome to Infectious Diseases TV. We share useful information about infectious diseases.
If you've ever had a really bad flu, you know the routine, right? That awful long swab up the nose, then you sit there for like 15 minutes just waiting. It feels like such a standard part of flu season. But what is that little test kit actually doing? And, the big question is, how much can we really trust the result it gives us? So today, let's break down the rapid flu test. Okay, so let's start with the basics. How does this thing that we're all so familiar with actually work? As you're about to see, the mechanics behind it are surprisingly simple. The process here is pretty darn straightforward. A nurse takes that sample with a swab, swirls it around in a little bit of solution, and then puts a few drops onto the test kit. Now, what's happening inside is that the test is on the lookout for antigens. Think of them as tiny pieces of the flu virus. If there's enough virus in your sample, it causes a reaction with antibodies that are already in the test strip, and boom, a colored line shows up. And just like that, you've got your answer in about 5 to 15 minutes. So you might be thinking, if there are more powerful lab tests out there, why do we even use this one? Well, it really just boils down to one single thing: speed. Getting that result right away, in the clinic, is the entire point. And this comparison here just makes it crystal clear, doesn't it? I mean, sure, you've got these super accurate lab tests, like a PCR test, but they can take hours, sometimes even days, to come back from a specialized lab. The rapid test, on the other hand, gives you an answer right there in the doctor's office. And that means your doctor can make an immediate treatment plan. And that speed, well, it's critical for one very, very specific reason. It is all about this timeline. Antiviral drugs, the ones that really help fight the flu, are way more effective when you start them within the first 48 hours of your symptoms. After that 2-day mark, their impact just drops off a cliff. So, a rapid test is designed specifically to get that diagnosis and get you a prescription all within that crucial window, which hopefully helps you get better faster. So, the test is fast. That's a huge plus, no doubt. But, and this is a big but, that speed comes at a cost. There's a major trade-off, a kind of hidden flaw that is absolutely essential to understand. And it all comes down to a concept called sensitivity.
So what is sensitivity? Well, it's really asking a simple question. If you actually have the flu, how likely is this test to correctly spot it? A test with low sensitivity is kind of like a smoke detector that only goes off for a massive fire, but it completely misses the small ones. It just misses things, and that produces what we call false negatives.
And here's where the rubber meets the road. The rapid flu test sensitivity is only around 50 to 70%. Now, let that sink in. That means for every 10 people who walk in and actually have the flu, the test might completely miss as many as 4 or even 5 of them. It tells them they're negative when they're actually sick. That's a huge margin of error. But wait, it can get even worse. The timing of the test is everything. If you get tested too early, say within the first 12 hours after your fever starts, there just might not be enough of the virus in your system for the test to pick up. And in that early window, the test sensitivity can plummet to as low as 35%. That's a massive, massive chance for a misleading negative result. Okay, so knowing about this pretty major flaw, how in the world are we supposed to interpret the results? Well, it turns out a positive result and a negative result mean two completely different things when it comes to how reliable they are. All right, first things first, let's tackle the positive result. This one, thankfully, is a lot more straightforward. So while the test struggles with sensitivity, it's actually excellent at something else called specificity. And that's its ability to correctly tell you when you don't have the disease. It's about 99% specific, which means false positives are incredibly rare. So the bottom line is, if your test comes back positive, you can be very, very confident that you have the flu. But now for the much trickier one. What if your result comes back negative? What does that mean? This is exactly where that low sensitivity we've been talking about really matters. A negative result is absolutely not a guarantee that you're in the clear. It just means the test didn't happen to detect the virus in that one little sample. It could very, very easily be a false negative. And all of this brings us to what is probably the single most important takeaway from this entire explainer. The test result itself is not the final word, not even close. You should think of a good diagnosis like a piece of detective work. Your doctor isn't just looking at one clue. They're considering everything: your specific symptoms, how much flu is circulating in your community at that moment, your own health history. The test result is just one data point in a much, much bigger puzzle.
And this quote really says it all, doesn't it? The rapid test is a helpful tool. It's a diagnostic aid, but it is not the final decision maker. I mean, if you have every single classic flu symptom and it's the middle of a major outbreak, your doctor might go ahead and treat you for the flu even if your test comes out negative. Their clinical judgment is what truly matters in the end. So I guess the real takeaway here is pretty simple. The flu test is a useful tool for sure, but it's an imperfect one. You can trust a positive result, but you should always question a negative one. And most importantly, always rely on your doctor's complete diagnosis. This is Infectious Diseases TV. Please like and subscribe.